All right, let's just jump right into this. For decades, we've basically been told just one story about type 2 diabetes. But what if that whole story is wrong? Today, we're going to explore a completely different way of looking at this disease, one that isn't about just managing symptoms, but about actually reversing the root cause. And this is all based on the fascinating work of Dr. Jason Fung. To really understand what's at stake here, we have to start with a real person. This is what Margaret said about her own life. After 27 years with type 2 diabetes, this is how she felt. She was on massive doses of insulin, she'd gained a ton of weight, and she had zero energy. This wasn't just numbers on a chart for her, this was her reality, every single day. Okay, now look at this. This is where it gets absolutely incredible. In just 3 weeks of a totally new approach, Margaret was off all of her medications. Her diabetes was, for all intents and purposes, reversed. She lost 64 pounds and got her energy back. I mean, her story just forces you to ask a really big question. Is type 2 diabetes really the disease we've been told it is? Yeah, Margaret's turnaround, it just completely shatters what most people are told about this disease. And that brings us to the first of two big lies that patients hear all the time, that it's a chronic, progressive life sentence, something you just have to manage and live with forever. And look, this isn't some vague idea. This is the official line from huge organizations like the American Diabetes Association. When they call it a progressive disease, it creates the sense of what Dr. Funk calls learned helplessness. Basically, it teaches you to believe there's nothing you can do. You just have to accept it. But as we're about to see, the evidence tells a very, very different story. The truth is, there are at least 3 well-known, well-documented paths that have been shown to actually reverse type 2 diabetes. Bariatric surgery, fasting, and very low-carb diets have all put this disease into remission for countless people. The fact that these cures even exist proves the disease isn't permanent. And if you're a data person, just look at this. This study is pretty striking. It compared bariatric surgery to standard medical therapy. After just 1 year, the patients getting the usual care were, well, still on all their medications. But the surgery group, whoa, they were almost entirely off their meds. It's just crystal clear, right? When you actually treat the root problem, the disease can go away. So if the disease is reversible, why isn't this the standard of care? Well, that brings us to the second big lie. The idea that the main goal of treatment is just to lower a number on a blood sugar test, that we're just chasing a symptom. To really get why this is such a huge problem, let me use a really simple analogy. Imagine you've got a bad infection. The root cause, the real problem, is the bacteria. The symptom your body creates is a fever. So, what do you treat? Do you treat the infection, or do you just treat the fever? The answer is obvious, right? Of course you treat the infection. You take antibiotics, you do that, and the fever takes care of itself. Just treating the fever, the symptom, does absolutely nothing to fix the real problem. And believe me, this isn't just a theory. The gigantic ACCORD study put this to the test. They took over 10,000 diabetic patients and used a ton of medication to aggressively lower their blood sugar. And the result? It was so shocking they had to stop the study early. The group with the perfectly controlled blood sugar wasn't doing better. They were doing worse. They had a higher risk of death. Chasing the symptom was literally harming them. And here's why. High blood sugar is just the fever. It's the tip of the iceberg, the thing we can easily see and measure. The actual disease, the real infection hiding below the surface, is something called high insulin resistance. So conventional treatments are all focused on the symptom, while the true disease gets worse and worse. Okay, so what is this underlying disease then? This brings us to the core of the whole explanation, the twin cycles hypothesis. This is the actual mechanism that causes type 2 diabetes to happen in the first place. It all kicks off with this vicious cycle in the liver. So first, a diet high in carbs and sugar makes your body produce a lot of insulin. That insulin tells your liver to make and store fat, which leads to a fatty liver. Second, as that liver gets all clogged up with fat, it starts ignoring insulin's signal. That's insulin resistance. So what does your body do? It panics and pumps out even more insulin to try to get the job done. And of course, more insulin just creates more fat in the liver, and the cycle just spirals out of control. But it doesn't stop there. Eventually, the liver is so overwhelmed with fat that it starts exporting it to other organs, including the pancreas. This creates a fatty pancreas. That fat literally clogs up the very cells, the beta cells, that are supposed to be making insulin. As they start to fail, your body loses its ability to control blood sugar. And that's the moment someone is officially diagnosed with type 2 diabetes. And honestly, this analogy from Dr. Fung just nails it. Think about packing a suitcase. At first, you can easily put your clothes in. But when it gets full, you have to use a lot more force. You literally have to sit on it, jump on it, just to shove more in. That extra force you're using, that's insulin resistance. Your body is just having to scream to get its message heard. So here's the beautiful part of all this. If we know what causes these cycles to spin forward, we know exactly how to drive them in reverse. We just have to go after the root cause. And this slide just lays out the two paths so clearly, it's amazing. On the left, you've got all the conventional treatments. Insulin shots, drugs that make you produce more insulin, high-carb diets. What do they all have in common? They all increase insulin, which we now know is what drives the disease. Now look at the right. Fasting, low-carb diets, bariatric surgery. What do they all do? They all dramatically decrease insulin. It's night and day. When you look at it this way, the conventional logic just falls apart. Giving more insulin to treat a disease caused by too much insulin? It makes absolutely no sense. Like Dr. Fung says, it's like trying to treat alcoholism by giving the person more alcohol. Yeah, it might calm them down for a minute, but it's making the actual disease catastrophically worse. And this is it. This is the fundamental paradigm shift. For 50 years, medicine has been asking the wrong question. The goal was never supposed to be just lowering blood sugar. The real, effective question we need to be asking is, how do we lower insulin? So let's just sum it all up. Here are the key things to take away from all this. Number 1, type 2 diabetes is not a life sentence. It's a reversible condition. Number 2, it's a disease of too much insulin, and high blood sugar is just a symptom of that. And finally, number 3, the true goal of any treatment that actually works has to be lowering insulin, not just playing whack-a-mole with blood sugar. So what's the big takeaway here? I mean, if this framework is right, it means the solution to one of the biggest health crises in the world isn't some expensive new drug. It's just a new understanding. It's knowledge, and it's available to everyone right now. And it really makes you wonder, doesn't it? What other fundamental truths about our health might be worth questioning?